So the world of acupuncture, has any one of you guys tried it?
No.
Never.
A friend of mine has rheumatitis.
And in front of Naya's.
And why did she need to go that
She
route?
loves
Being pricked.
Whoa. Okay.
So why would someone need acupuncture, you ask, right? So the general theory of acupuncture is based on the premise that there are patterns of energy flow through the body that are essential for health. When these flows are disrupted, it is believed that the disruption of the flows is what is responsible for diseases and ailments. So acupuncture is said to correct imbalances of flow at points that have been identified that are very close to the skin.
I know you've brought a professional to talk about this, huh?
Absolutely. We're going to be talking to Dr. Hu from HC Health. He's a registered Chinese medicine and acupuncture practitioner, both in South Africa and China, so we can get more information about acupuncture.
I'm interested. Really am. All right. Acupuncture is what we're talking about. Is the doctor there?
On the line, we have Dr. Hu.
Dr. Hu, you live on Metro FM. How are you?
Good yourself?
Wonderful. Thank you. Thank you for your time. We're talking the weird and wonderful world of acupuncture.
Yes.
From a Chinese healthcare perspective, what exactly is it?
So acupuncture is a kind of a tumor in Chinese medicine which treats diseases by inserting needles into specific points of our body. It has the function of improving the circulation of both qi, which is energy, and blood, and it can balance them as well.
So it deals mostly with the energy in someone's body.
Yes, energy and blood, yes.
And what type of needles are used? Is it different needles for different points in the body?
Yeah, in the past we used the gold needle and silver needles, but they were just far too expensive. So nowadays, in order to make the treatment safer and effective, we use disposable stainless steel needles. We do not reuse the needles, so that there will be no risk of contagious diseases during the treatment.
So Thomas was complaining about a migraine earlier. In this case, where exactly would you insert the needles? On his head?
So for migraine, it depends the area actually, because the meridian, the channel, which is the channel of energy move. For normal migraine, we put the needles in your head area, some of them, and sometimes we also put some on your hand as well, because they are connected.
Okay.
So there are. What exactly in the hand is connected to the head?
It depends on the area. So if the pen is around your ear region, it's related to the gallbladder meridian, which is the channel. Then we can use some points on your hand, can help to relieve the migraine on the area. But if the migraine is on top of your head, we will choose others because they are all in different channels.
Dr. Thomas here. I'm Dr. Hu. We're having a chat with Dr. Hu, a registered Chinese medicine and acupuncture practitioner. Doctor, listen, you were touching on the needle. So can you give us a basic understanding of what is the difference between a hypodermic needle and the one that you use for acupuncture?
You know, the needle we use is very thin. It's disposable and it's very clean and very thin. The diameter of the needle we use is only 0.3 millimeter. So it's very thin.
So very thin and not hollow like the actual hypodermic needle itself, huh?
Yes.
So what is now the ear acupuncture? What happens there? Because I've seen people going for ear acupuncture. What happens when they do that?
Ear acupuncture is part of the body acupuncture. So when we have the treatment, sometimes we use the body acupuncture, which we insert specific needle in the body. And the other one, ear acupuncture, sometimes we put different fruit seeds on your ear, then you can press them. It actually causes the acupressure.
Mm-hmm.
So for the ear acupuncture, in most conditions, we don't put very deep, and sometimes we don't even put needles. We only use the seeds to attach to your ear, and then you can press by yourself. For the advantage of ear acupuncture is we can keep there for long because it's safe.
Okay.
The acupuncture we know is used to heal, right? Are there any side effects?
Not really, because the needle, there's no medication there.
Oh, can you incorrectly place the needles?
Sorry?
Can you incorrectly place the needles?
Yes, but it's not because of the treatment. It might because of the person who performed the treatment. So if they are not proper trained or they are not even a doctor, that will be a problem. If acupuncture was performed by a qualified doctor, there's actually no side effects and very safe, actually.
Oh, that's great. So we want to hear from you, your views on acupuncture. Have you ever tried it? Is it something that you would consider in the future? Lebu's friend did. We haven't. I would love to one day. But let us know what your experience has been. Call us now on 089 110 3377.
089 110 3377. Let's get your calls. Because we've got Dr. Who on the line, who's a registered Chinese medicine and acupuncture practitioner.
Doctor who?
Who? Don't do that. Don't do that, man.
I thought that was cute, okay.
Doc, you still there?
Yes.
089 110 3377. Let's see. Is the doc still there?
On the line, we still have Doctor Who.
Hello, Doc.
Hi, yes?
Just before we get to our callers, so I've seen how the doctor walks up to the patients, and the first thing you do is touch the person's wrist, and I guess you check the pulse or whatever. What is it? Why do you do it on both sides as well? What are you doing in the beginning? And the sticking out of the tongue thing, what's that all about?
The tongue, in Chinese medicine diagnosis, we use more four methods. One observation, we check the tongue color. The tongue color can indicate your body condition, and the coating on top tongue. If you got very thick coating, it can indicate you've got very poor digestive system. And the pulse on your both hands, they are related to your organs. For instance, on the left-hand side, it's related to your heart, liver, and kidney. And on your right-hand side, it's related to your lung, spleen, and kidney. So we feel the feelings on your pulse. We can tell what's your body condition, how balanced they are, and that can conclude the treatment plan.
Wow, okay. Let me see your tongue, Paul. Your Tai Chi. Your chi is very rebellious, as they would say.
Wow.
I'm worried about you.
On the line, we have Bongani from Boxburg.
Hey, Bongani, do you have a question for our doctor?
I don't have a question, I have a comment because I was trying to touch it.
Mm-hmm.
Yeah, based on that is quite a bit, so I started after a while, and then I went to Roma with this Chinese doctor, and then they did that sponsor. But then it does work, but then I think it's something that honestly we want to do that the multiple times for you to properly do the pregnancy. Because if you do that, the moment you done it, you can feel it different instantly. And then the reason that they use that seem like your, what you call your, like, like the team, but when they are low. So my questions are the interpret moving from the ankle, going up the leg, up on the way, like on one side of the leg, all the way to the front. But then when they took out these needles, and then I saw the length of the face, so much I was like, I think to be just more inside of the because it's pulling down the stomach.
Unfortunately, we've got a terrible line, but we got the gist of what you're saying.
But we were getting that he had a back problem and he went for acupuncture
And it
really
worked, yeah.
On the line, we have Natasha from Centurion.
Hello, Natasha.
Hi, how are you?
Wonderful, thank you. We've got Dr. Who on the line.
Yes. Hi, Dr. Who. I have a really quick comment and a really quick question. So back in the United States, I'm a doctor of physical therapy, and we actually use dry needling, which is very similar to acupuncture. So I wanted to know, because I've never had true acupuncture, I've just been doing my dry needling to myself and to my patients back in the States. Have you ever had anyone have an emotional release when you remove the needles where, like, they start crying hysterically and they can't control their emotions because their chi was that out of whack when you're done needling them?
Oh, Natasha, I love the question.
Good question.
Doc, give us the answer after this.
Weird and wonderful. Weird and wonderful.
089 110 3377. Let's go back quickly to Natasha. I hope she's still there. Natasha, if you're still there, please ask that question again. I loved it.
On on the line, we still have Doctor Who as well as Natasha from Centurion.
Hey, Natasha, so please start that question again.
Okay, so my question was, because even in my practice back in the U.S., when I was doing dry needling, if I hit the right point and it disrupts their chi, people have emotional responses where like crying hysterically. So I was wondering if the doctor ever had that happen when he's doing like regular acupuncture to his patients.
Thanks for the call, Natasha. Doc?
Yes, not really. For that condition, we normally in acupuncture, if you happen this, we will change the points or change the direction of the needle.
Ah, okay. So that emotional outburst doesn't actually happen in your experience. Dr. Who, thank you so much for your time. Really appreciate it. So the ladies in the studio are really thinking about doing it. Yes, Paul?
Yeah, I also want to know, before you go, Doctor Who, how much would one session of acupuncture generally cost?
It depends on the practitioner and depends on the area where you attend to and also how experienced the practitioner are. So in most cases, it may range anything from few hundred to 1,000 per session. Mm-hmm. In general, acupuncture in Cape Town is slightly cheaper than Joburg.
Oh, why is that?
Altitude.
That's as far as I know, because I knew some practitioners there, how much they charge, and the one in Joburg, how much they charge.
Sure, okay. Dr. Who, thank you.
With pleasure.
Oh, it's so nice, eh? You go do it. Go do it, Sean.
You know I'm going to try.
I know you're going to go do it. Lebza, go do it, Kim.
Well, I'm also going to. I'm also going to.
Mel, you are always in a good chi. You fine right now.